Now with our GMA cover story, going back to school better than ever and how to prepare your family for optimal health this school year, even as we've experienced the highest summer COVID surge in 2 years. Pediatrician Dr. Edith Bracho-Sanchez is joining us now. Dr. Edith, good morning. It's great to have you.
Great to be here. Good morning.
So we did note there that kids are heading back to school. There is this COVID surge, but there are some changes in terms of who can have access to free COVID vaccines. What do parents need to know?
That's right, Whit. So we know that the Bridge program, which has provided free access to COVID vaccines, is ending on August 31st. Important to know that children will continue to have access to free COVID vaccines through the Vaccine for Children program. And that is true for all vaccines, including COVID. Now, for adults, there is a range, as you know, of insurance coverage, right? So we want to make sure if we have any insurance at all, that we are checking with our provider to see what this is going to mean for us. If we don't have insurance, then we want to make sure that we're calling local health departments, and it's a good idea to go on healthcare.gov to look into getting coverage through the Affordable Care Act.
And I think so many people have questions about when to get the new vaccine. Should people be waiting to get the new one, which I think comes out in a couple of weeks now?
That's right. So waiting with caveats. So if you have already completed your primary series, and we know that for young kids, it takes a couple of doses. If you already have completed those and all you're getting is a booster for your child, yes, wait, because the new vaccine, I should say the updated vaccine, because it's not new, it's updated, will protect you for this year's strain of the virus that is circulating. So yes, wait. However, if you haven't gotten any vaccines at all, go ahead and look into that now.
All right. So, doctor, beyond the vaccines, what should we all be getting ready for when we're looking at the kids going back to school?
Yeah, you know, back to school is back to basics. So vaccines are definitely a priority, but we also want to make sure that we've gotten a full checkup with your pediatrician, that prescriptions are up to date, forms are up to date. A nurse at school cannot deliver a medication without proper documentation. So look and ask, what are those things that are required? Glass is always a good idea to make sure are up to date. And parents should be doing all of these things too, by the way. It's a good idea to remember.
Not just the kids.
Yes, let's all get our checkups in.
And so my kids don't go back to school until after Labor Day, but this is this stressful period where we transition from summertime schedules where it's like anything goes back to the school schedule. What should we be doing as parents, as families, to balance the mental and physical health?
I'm so glad you're bringing this up because it is exciting. Going back to school is definitely exciting, but it can also be stressful. Anything goes during the summer, but then you have to juggle schedules. You have to make sure everyone makes it out the door on time, and then weekend activities. So make room for the transition. That's really the number one thing I can say. Make room. Don't overschedule yourself professionally or socially as a parent, right? For your children, that is true as well. And then really for kids who already have mental health conditions, anxiety, depression, whatever it may be, schedule extra therapy sessions. We know that they can struggle a little bit. And then for kids who don't, make sure that you're blocking time to check in and that you're giving them healthy outlets in this transition period.
That extra prep, transition time, getting ready is key. Doctor, thank you so much. As always, we appreciate it.
Thank you.
Exciting, but often chaotic time, at least in my house.
Yes, exactly. Yes.
Thank you, Doctor.
A little bit of both.